Hi, everyone. My name is Esmeralda, and I am the Partnerships and Policy Manager at the Low Income Investment Fund and spend most of my time working on Build Up California, which is an initiative of LIF. Welcome to Build Up California's March Network meeting. We want to acknowledge that this is Women's History Month and it's coming to a close. We're excited for April. Today, we are going to have a presentation on children's health and climate change by Amal Syed, who's from the Office of Environmental Health Hazard Assessment at the California Environmental Protection Agency. I'm also joined today by Samantha Payton and Leslie Hutchinson from our team who are supporting the meeting and will be monitoring the chat. I'm going to now go through our agenda for our meeting, which is very, very short. The first part will be this, which is our housekeeping, and then I'll hand it over to Amal, who will be doing our presentation today. And we hope to have some time left over for you to have questions and answers. Please use the question and answer function that is in the Zoom room to ask questions. If you are not able to access it, if you're on a phone, you can throw it in the chat if that's easier as well. We will be monitoring that. And at the end, we have a short survey, so please make sure you fill that out for us. And as we get started, if you don't mind putting your name and organization and where you are located in the chat, that would be great. We would love to know who's here in community with us. And all that being said, I'm going to hand it over to our awesome presenter today, Amal, who will be spotlighting the work of children's health and climate.
Thank you so much, Esmeralda. I'm going to go ahead and share my screen. Please let me know if you're able to see that okay.
Yes.
Okay, perfect. Hi, everyone. I hope you're all doing well. Thank you so much for having me here today. My name is Amal Syed. I am a research scientist at the Office of Environmental Health Hazard Assessment, or as we like to call it, OEHA, just because it's too long. I work in their air and climate epidemiology section, and I specialize in children's health and maternal health. And today I will be speaking with you about the impact of wildfires and heat on children's health and what we can all do to help protect them. So before we get started, I just wanted to give a little introduction into my work and the office that I work for. So OEHA is a state agency within CalEPA, the Environmental Protection Agency. And this agency leads assessment of health risks posed by environmental contaminants to protect the health of people living in California. So we focus on a lot of different areas of the environment, whether that be fish and wildlife, personal care products, pesticide use, or my area of expertise, air and climate. In the air and climate section, we focus on health impacts of hazards like air pollutants, wildfires, heat, dust, and drought. And we also develop recommendations for lowering state and national air quality standards. My specific focus is how these air and climate health hazards affect vulnerable populations like children and pregnant people. So every few years, OEHA releases an Indicators of Climate Change report, which summarizes different ways we can all observe the effects of the climate crisis in California. And this one quote from the 2022 report really stuck out to me. So it says, "The stark reality of climate change in California is clear. Record high temperatures, an unrelenting drought, and unprecedented wildfires. The evidence continues to mount of the impact of climate change on the health, safety, and well-being of the state's residents. Californians are at a unique risk of experiencing many climate health hazards at once. And these hazards not only have an impact on our environment, but can also have an effect on our health and well-being. And what I want to do in this presentation is help us understand why that is. So let's start off with talking about air pollution. There are two types of air pollution that we commonly talk about in our section. The first is ambient air pollution, and that refers to pollutants that are released from different everyday sources like factories or cars or gas ovens and stoves. And the most common pollutants for ambient air are ozone, carbon monoxide, nitrogen dioxide, and fine particulate matter, also known as PM 2.5. So you're going to hear me say PM 2.5 throughout this presentation, just because that is kind of the focus of a lot of climate change related air pollution. And just for background information, the 2.5 at the end of that PM, that indicates the size of the particle. So the PM 2.5 is a concern due to its small size. It can easily penetrate into our lungs when we breathe it in and can affect other organs through our bloodstream. So the other type of air pollution is wildfire air pollution, and this is specific to air pollutants that are released due to wildfires. The main component of wildfire air pollution is the pollutant that I mentioned, PM 2.5. Wildfires are a concern because concentrations of air pollutants like PM 2.5 increase, and those who are nearby the source of the fire are exposed to a large amount of pollutants in a short amount of time. Also, depending on what is being burned, for example, if it's not usually wood sources, if it's buildings that are being burned, wildfire smoke can actually also contain other toxic chemicals. So both of these sources of air pollution can affect your indoor air quality. So just going quickly into the health impacts of wildfire smoke, I think we can all imagine that physical injury and burns can occur, especially if somebody is really close to the smoke. They can also suffer suffocation just from breathing in too much smoke too fast. Individuals can also undergo emotional stress with the loss of maybe their job or employment or their home. But the health impact we focus on the most is what can happen through the inhalation of smoke. So the inhalation of excess amounts of smoke is commonly known to affect our respiratory system, so our lungs, and our cardiovascular system, so our heart. This can be worse for people who have chronic diseases like asthma, and other minor impacts can be allergic reactions and physical irritation of eyes, nose, and skin. And wildfires can, like I mentioned, can be very stressful, but this can be especially true for children. Since they're so young, they may not know how to handle the amount of stress, especially if they need to evacuate or they fear for their safety. So that's something that we need to keep in mind. So like I mentioned, air pollution outdoors can affect your indoor air quality. But there are also other sources inside your home that can affect your indoor air quality. For example, there could be biological contaminants. So this could be if you have a lot of flowers in the house, that there could be pollen from the flowers, or mold and viruses. So these can affect maybe somebody who has allergies inside the house. Gas stoves and ovens can also emit air pollutants like carbon monoxide, nitrogen dioxide, and PM. Any pesticides that you use outdoors can also drift inside. And a concern sometimes in schools or places with children are fumes from chemicals like cleaning products or paints, glues, and other scented products like air fresheners or candles. Those can also impact your indoor air quality. So those things are, very commonplace, and it's sometimes hard to replace all of those sources. So it's important instead to kind of improve your indoor air quality. And when you do that, that can reduce your exposure to harmful chemicals, and it can reduce the risk of respiratory infections, asthma, things like that, especially in children. A lot of schools that have worked on improving their indoor air quality have actually found that children are becoming less sick because the ventilation and the filtering of indoor air can actually clean the air. And it can actually improve student performance and attendance. It's also been found in different areas that when the air quality is poor indoors, students have a harder time focusing. They may not want to show up for school, or they may not do as well on their tests. So for more information on indoor air quality in schools and in areas where children usually are, you can look on the US EPA website, which Samantha will be putting in the chat. And later on in the next few slides, I'm going to be covering on specific actions that we can all take to improve our indoor air quality. before that, I just want to mention extreme heat. So, extreme heat is an event where 2 or more days and nights of unusually high heat occur in your region. So, as climate change progresses, extreme heat waves in California are becoming more frequent, more severe, and longer lasting than years before. And unlike other weather hazards, during extreme heat wave, individuals are becoming more sick at a higher rate. So, California, I think we can all, I don't know, remember from the past few years is getting pretty hot during the summer and it's heating a lot faster year after year. So, actually, in July 2023, more than 200 maximum temperature records were broken. And something to also keep in mind with climate change is that there can also be a co-occurrence of different climate change events. So oftentimes, maybe you've noticed that during hot weather, wildfires can spark really easily due to the high heat. And the combined events of extreme heat and wildfires can also cause people to be more sick. But we're gonna, again, cover some different things on what we can do to protect people. So just something to look out for. So some signs and symptoms of heat-related illness to look out for. These are specific to children. And so heat-related illness is one of the most common health effects and can progress to become more serious to something like heat stroke. So for heat illness, some symptoms to look out for in children are dry skin, dry mouth, heavy sweating, dark colored urine or very little urine, crying without making tears, muscle cramps, fast heart rate or fast breathing, headaches, dizziness, or irritability. And then if you notice, in addition to this, on a very hot day, the children also have nausea or vomiting, confusion or sleepiness, slurred speech, seizures, or a high fever, those can be signs of a heat stroke, and it's recommended that you call 911 immediately, just to protect the child as soon as possible. So I think it's really important to kind of keep these symptoms handy just so that you are aware during hot days. So I did talk a little bit about the climate hazards, and I want to talk to you a little bit about why children can be more susceptible to the effects of wildfire smoke and extreme heat. So first, wildfire smoke can be specifically detrimental to children's health because they're still growing. They have developing physiological systems, especially their respiratory system, their cardiovascular system, their immune system. And since they are still developing, they usually have smaller lungs and smaller airways. Because of that, the air that they breathe and the PM that they breathe in, that pollutant, can easily deposit itself in their lungs and their airways. Children, especially those that are under the age of 5, they're also known to breathe through their mouth more rather than their nose. So that can allow them to inhale more air. And since they are still growing, they can inhale more air relative to how large their lung is. So that can allow more air to enter their body as well. And because of this, they can also absorb heat at a higher rate. So this can affect them during extreme heat waves. And since their body's systems are still developing, they have lower sweat rates, so they're not able to sweat as much, and they have higher core body temperatures. So that makes it really hard for their bodies to efficiently cool down. And like I mentioned, since they're breathing in a lot of air, during hot days, they can breathe in that hot, humid air faster than adults. They're also more vulnerable just behaviorally. They spend more time outdoors, whether that's at home or at school, so they're exposed maybe to the air pollution outside or to the heat more. And also, children are more dependent on their caregivers or their parents for their physical health. They may not know when to drink more water or to cool down. And since they're not aware of climate hazards or maybe the concept of climate change, they don't know what the proper ways to protect themselves are or why they need to protect themselves. So that's why it's so important for educators and people who are caregiving for children to kind of be aware of what they can do to protect children. Another thing to kind of keep in mind is that children depend heavily on social interaction and physical activity for their growth. And if these are impacted, this can really affect their mental health and well-being down the line. So, okay, heard a lot of scary stuff, but what can we do and what should we do to protect children's health? There's definitely a lot of things that can be done. So first, I want to start with talking about how to improve our indoor air quality. So the first thing is if you have an heating, ventilation, and air conditioning system, an HVAC system, that one is really great at filtering out outdoor air. So you want to make sure that it's regularly cleaned, especially the filters in that system. And you want to look into optimizing or upgrading it. A link that's going to be put in the chat has some more details on how you can do that and what you should look out for. Next, ventilation and fresh air is the best way to get rid of any chemical fumes or indoor pollutants. So creating cross ventilation by opening windows or doors that are opposite from each other is a great way to get a fresh intake of air. This does have its exceptions though. It's best not to do this during a wildfire event because you don't want to allow the smoky air from wildfires into your homes or your spaces. So during those times, it's best to keep your windows and doors closed and sealed. But outside of those events, it's really great to have some natural ventilation. The next thing that you can do is use a portable air cleaning device or air purifier. So you want to make sure that these air purifiers also have high efficiency particulate air filters, also called HEPA filters. Those are the best ones to kind of help you clean your spaces in the most effective way. And you also want to make sure, like with anything, that you are consistently cleaning your filter and that they're kept on during busy times when there's a lot of children around or a lot of people around, that the air purifier is on. Lastly, we recommend that to try to switch out products with any harsh chemicals, especially scented products. So a lot of sources online recommend using unscented hand soaps or lotions and lean away from using candles or incense inside of the space when there's a lot of children around. And, you know, finding alternatives for paints and glues or cleaning solutions that maybe have harsher chemicals could be a really great way in just reducing that indoor air pollution. And the link that was put in the chat can kind of help you navigate that. So, like I mentioned, it's really great to get a portable air cleaner or air purifier, but getting one can be expensive and it's not easy for everyone to do. But there's a really great way that you can maybe DIY one in your home with things that you already have. So the link for the YouTube video will be on the chat, but I'm also just going to share this. Press play over here. Let me know if you're able to hear it.
Yes.
You can easily make a
do-it-yourself
air cleaner to remove tiny harmful particles and bad air. Lay a 20-inch box fan face down. Put a 20-inch furnace filter with a MERV rating between 11 and 14 on the back of the fan where the air comes in with the flow arrows pointing to the front. Hold the filter in place with a bungee cord. And that's it. Use it in a small room with the windows and doors closed. As the same air keeps moving through the filter, it captures more and more harmful particles. Don't put it in an open window. It will pull in more bad air. Tests have shown that tiny particles in the room are greatly reduced using this fan and filter. Check and change the filter when it gets dirty. The filter may make the fan work harder and get hot, so turn it off when you're not home.
Yeah, I really like that video, and I think it's a really great way in case you just, you know, don't have the time to go buy an air purifier or you can't find ones or they're just not within your budget. To make one at home is a really great solution. And the items on here are maybe a little bit easier to access. So yeah, like I mentioned before, the link for the video will be in the chat if you want to reference it. Now we're going to talk about how to protect children from wildfire smoke specifically. So, like we just talked about, filtering your inside air is super important. During a wildfire event, if you're nearby or the conditions outside are smoky, you want to make sure that you're not letting any smoky air from outside inside. So, try to make sure that your windows and doors are properly sealed. And if you do have maybe gaps where you think air from outside may enter, try to seal it some way, maybe with like a towel or something before the warm season or wildfire season. And like I said before, using portable indoor air purifiers is also a really great way in making sure that your indoor air remains purified. So during a wildfire, you also want to stay indoors as much as possible and limit children's outdoor physical activity. So exerting their body in smoky air could cause respiratory or breathing problems and can also cause exhaustion for children. And that's especially if they have other conditions like asthma. So trying to stay indoors and limiting outdoor physical exertion is really important. If you do need to go outside, it's important to, again, limit how much you're exerting. And for adults and older kids, we recommend like maybe ages 12 and above, depending on their face size. They can also try wearing a mask or a face covering to prevent that smoky air again from breathing it in. And you also want to make sure you are monitoring children's activity and health. First, monitoring their physical activity and social engagement levels. So if during a long smoke event you feel like children, they're just not acting as social as they usually are, or they're more fatigued as usual, you really want to make sure that they are hydrated and also let their parents or their physician know what you have observed. They may want to consider taking their kids to get checked up for any respiratory issues to see if maybe they have asthma or their asthma is acting up, which is causing them to be a bit more tired. And then for kids that you already know that they have respiratory issues like asthma, you want to make sure that during wildfire events, you are monitoring them closely. And you want to make sure that you have their maybe medical plans or medical equipment ready with you, like inhalers in case they need them. And in the chat, you'll find a fact sheet, which also summarizes some other tips and tricks that you can utilize during a wildfire event. So sometimes it's not possible to keep kids indoor all day long. But how can we know when it's safe to go outside for long periods of time? The best way to do that is to monitor and keep track of your air quality levels or AQI. So you can find your AQI usually on the weather app on your phone, and it can tell you if the air quality in your area is good, moderate, bad. Sometimes it says not safe for sensitive populations. And something to keep in mind is that children fall under that sensitive populations category. So when that comes up, just know that going outside or being outside for a long period of time is maybe not safe for children. You can also go to airnow.gov to look at your current AQI for the day, but also the AQI over the next several days. If you want to plan, an activity next week or at the end of the week, it gives you a good idea of what your AQI in the area might be. So after you know what your AQI levels are, you can refer to activity guidelines. So this one is made by the California Department of Education. And as you can see here, it has different levels, and each of these levels correspond to different levels of the AQI. So if the AQI level is at 1 or good, you can see that for recess PE, athletic practice training, scheduled sporting events, that you have no restrictions for children. But as it continues to increase, you see that for each one, what you should do. So for example, when it's at level 3 and you have a 2 to 4 hour athletic practice or training, you can reduce vigorous exercise to 30 minutes per hour of practice time with increased rest breaks and substitutions. So this is a really great way of just kind of understanding what you can do for different time intervals and depending on the AQI. Another really great example is this one from the Washington Department of Health. They also have it per time And it's very similar, but their wording of it is really great too. So that is also going to be put in the chat if you want to see a little bit more on their details. But I think this is just a really great resource to keep in mind during wildfire seasons. When you're monitoring the AQI, you can also monitor the activity guidelines. Okay, so moving on to extreme heat. So to track your heat levels in the area, you can use a new resource from OEHA, the department that I work for, called Cal Heat Score. So that measures each zip code's heat impact level on a scale from 0 to 4. It also forecasts future Cal Heat scores for the rest of the week, so you can also plan out your activities. Here's a little chart that they have on the website where you can see what each Cal Heat score value corresponds with the meaning and the impact level. So for example, if you go on the map and you put in your zip code and it comes up gray, that means that your impact level is low and you have a below baseline level of heat-related health risk. If you have it at 1, it's mild, and that means it's a warm day. So your community risk of heat-related illness may increase up to 1/3 above the baseline. When it goes up to 2, that's moderate. That means it is a hot day, and your risk of heat-related illness may increase up to 2/3 above the baseline. When it's at 3, that's high, meaning it's a very hot day, and this may double your risk of heat-related illness. And at 4, it's severe, and it can affect anyone without effective cooling and or adequate hydration. So this is a really great way for you to kind of plan out, again, activities to see what you should do, see what the days are looking like. And yeah, so this tool is still in progress, but it is online. So in the chat, you will find the link to the prototype mapping tool, so you can play around with it. And there's also a place for you to give your feedback. But yeah, this is an example of what the map would look like. You could click, I just clicked this zip code of 95691, and it told me right now, since we're in spring, that we do have a lower level of heat-related health risk. But if it was higher, it would tell you over here. And we have a video to kind of give a short demo of what the map is like. So I'm going to play this and let me know if you're able to hear it.
A link to the Cal Heat Score mapping tool is available from the main Cal Heat Score website. When the page loads, you can see a map of California with zip code boundaries. The Cal Heat Score ranking colors populate the zip codes. Since we are still early in the year, it is not surprising that there are no dark colors on the map. We can see several zip codes that have a Cal Heat Score of 1. We can select any day in the upcoming week to see the forecast for that day. You can see that the distribution of Cal Heat scores changes every day. This ability to check the forecast will help you plan and prepare for an upcoming heat event. To navigate to a specific zip code, you can either zoom in or you can enter the zip in the search bar. To see the zip-specific information, you will still need to click on the map. When you click on the map, information about that zip code populates in the center panel. Here you can see the day's forecast Cal Heat Score, the population size, and the average and record temperatures. The tabs on the bottom take you to additional demographic profiles. The age profile shows the proportion of the population in the zip code at each age grouping. The age groups are children under 5, children between 5 and 17, adults 18 to 64, and adults age 65 and older. The Cool Center tab shows various cool centers around the state. This information is hosted by the counties and is currently an incomplete list. We expect to show more cool centers as the weather warms up. These are places you can go to cool down when the temperatures rise. They are often community centers or libraries. You should call ahead to check their hours of operation, as they could be different than what is displayed here. The guidance button opens up the Cal Heat Score value and impact legend. Below this is a section called Look Out for Others. Here are links to the heat-ready resources specifically for each of the populations listed, including infants and young children. Back on the main page, there is also a resources button. Here are infographics with tips and tools. At the bottom of this page are links to sign up for alerts through either California Office of Emergency Services or Listos California. There is also a link to Heat Ready California, which has additional heat-related information. This concludes our brief tour of the Cal Heat Score mapping tool.
So yeah, that is a kind of a brief introduction to the tool, but like I mentioned, it's going to be in the chat if you want to kind of play around with it yourself, look at your own area. There were a few hot days this week, so maybe it's going to show up there now. And like I mentioned, it is still a prototype, so they're hoping to have the final version out later this year. But if you do have any questions or comments about it, there is a button in the tool called feedback where you can email them and let them know maybe a certain part of it is not working or isn't accurate, or you just have a question. You can put that in that feedback button. But yeah, I recommend that you play around with it, and I think it's a really great way to kind of understand, what is your heat level looking like at the times that maybe you have children in your care, you want to plan out a sports activity or an outdoor activity. It's good to kind of look at that forecast to see what level of heat you may be dealing with. Okay, so now that we know what heat levels could be dangerous, what can be done to protect children during extreme heat? So the first thing is to monitor your local Cal Heat Score levels during the summer. You want to limit or cancel activities as the guidelines suggest. So maybe if the Cal Heat Score is very high, you want to limit or cancel outdoor activities that are longer than 15 minutes. You want to make sure that you are hydrating children, and children are hydrated with water or electrolyte drinks. It's best to maybe avoid sugary or caffeinated drinks that might make them more thirsty. You want to also regulate your indoor temperatures. You want to keep your fan or AC on. And if there's a breeze outside and it's not smoky, you can try ventilating your space. And you can set your AC to 75 to 80 degrees. When kids are active, even indoors, you want to encourage regular breaks for them to rest and hydrate. And that could be at least one break every hour. You want to remind parents and encourage children to dress in light-colored, loose, lightweight clothing, especially when it's really sunny outside. You want to try to keep ice packs and wet towels on hand in case you need to quickly cool a child down. If you feel like a child is overheating, you can quickly apply a wet towel or an ice pack to their forehead or back of their neck for a short period of time, just to kind of get rid of that overheating feeling. And it's also important to keep sunscreen on hand. If children are going to be outdoors, you want to make sure that they have the sun protections to protect against sunburns and things like that. And those symptoms that I mentioned before, you want to keep those handy and you want to monitor the children's symptoms. And if those severe symptoms of heat stroke occur, you want to call 911 immediately. And it's also really important to time outdoor activities for cooler parts of the day. So mornings and evenings are usually cooler, but sometimes they're not. So you just want to make sure that you're, checking on those forecasts. And even if you do have morning or evening outdoor time, you still want to encourage play and rest in shaded areas and hydration, especially. And so another thing that's going to be in the chat that's available in both English and Spanish is a fact sheet on how how you can protect children, infants, kids, and teens from extreme heat. So that's everything. Thank you so much for listening. And please let me know if you have any questions. I'd be happy to answer them right now. But if something comes up later, you're looking through the resources and you're a bit confused, please feel free to email me. I'd be more than happy to answer any of your questions or connect you with anybody who can answer your questions properly. Thank you so much.
Thank you so much, Amal. That was a great presentation. I really loved those tools. I put a photo of my son in the chat of him during his favorite outdoor activity on one of those hot days that we had this week when it was a little like less hot outside. And it's just a great reminder that we have to make sure that we're doing things for them to make sure they're able to regulate because like you said, they have their own challenges. They're not able to self-regulate. They're not as developed. So I really appreciate all that information. And I really liked the video about the portable air cleaner. I saw one of the participants in the chat share that it was like giving her flashbacks of some of the fires that happened in the past. So thank you for sharing all those resources. And now we're going to open it up to the folks that are in the space with us and allow them to ask questions and answers. I see that we don't well, we had one question in there about the PowerPoint being shared, which was already answered, and we will be sharing this post-meeting, but want to invite folks to ask any other questions that they may have with regards to the presentation now. I am not seeing anything in the chat or inside the Q&A. But I do want to remind everyone that Amal is a resource moving forward. She did have her email address on the last slide of the slide deck, so you will have that and you're able to connect with her post-meeting. I want to make sure that I remind everyone, ooh, there's a question before I got excited about the end, but here. What sorts of features should be built into childcare facilities to try and address these issues? Matt Tinsley. Thanks, Matt.
I think it's really important, if you're talking about like physical features, making sure that there is like a consistent optimization or upgrade, or at least a checking of one's HVAC systems, if that's a thing. So making sure that HVAC systems are regularly checked to make sure first that they're filtering the indoor air, but also during extreme heat that they're able to, pump in cool air and cool down a space in an efficient amount of time. That's really important. I also think that, having, like I mentioned, air purifiers are not cheap. I think it's really important to have accessible resources for childcare facilities, like air purifiers that are maybe on a lower budget or are easily accessible, like I mentioned. Yeah, I think those two things are really important in cleaning your indoor air. And just like education, I think it's so important to keep, maybe people are not aware of the different activity guidelines during certain AQIs or activity guidelines for certain heat levels. Keeping those handy and provided to childcare facilities is really important. And just, refreshing every year, things are changing when it comes to our climate in California. So having trainings or having these types of discussions on a yearly basis, I think is really important. I hope that answered your question.
Great. There's also a question I see in the chat. I'm going to read it out loud for our interpreter. How is the partnership between fire departments and Cal EPA supporting the preparation of childcare facilities to handle the impacts of wildfires and extreme weather events, like extreme heat, for instance?
So what's really great also is that so CAL FIRE is another agency within the California state, and they also release a fire mapping tool that kind of shows on a county to county basis, but also like on a statewide basis, which areas have a higher risk of wildfires. So that's really important in just understanding, especially for the location of a child care facility. If it falls within the area of a wildfire risk, then that's that's a school or that's a facility that really needs to be, monitored and needs to be kept in communication, especially during high wildfire risk. So I personally do not have a partnership with fire departments, but at CalEPA within OEHA, we use a lot of their resources, like that Cal Fire mapping tool, to build our own research and to understand, based on locations of, childcare facilities or schools, and wildfire risk, what we can do to kind of get communication, health communication spread to areas that might be at a higher risk for wildfires.
Thank you. I'm going to check the Q&A section one more time. I'm not seeing anything. I'll leave it open for folks to ask questions, and also we are going to throw in the chat or I think we might be actually enabling the survey. We're going to enable a survey for you to provide some feedback on the meeting. It's very short. It's only 6 questions, and it is in the chat. So if you can please go ahead and click on that link. It's very, very short. If you want to hang on and ask a question, we're here. It's in the chat, and if you have something else, you are welcome to log off. But before you do, I do want to say thank you so much to Amal, who joined us today for her presentation. She's a resource. Thank you for joining us today and sharing space. I hope you take some time to share your thoughts on this meeting, and if you have any other feedback that you want to share. I think it's really important that we work together to address this new climate reality that we're facing and build communities where our children can thrive together. So thank you, Amal, for being here. And thank you all for joining us today. And it looks like I see another question. So many childcare centers do not have HVAC systems or funding to purchase install them. Any sources of funds you know of for this?
That's a really good question. I right now do not know, but I will do some research and get back to you. I can send them to Esmeralda to maybe send out. I know that CARB, which is the California Air Resources Board, they do a lot of work with the grants and stuff. So I can check in to see if they have any active grants for that. And CalEPA wide has environmental justice action grants. And those ones are usually for nonprofits or tribal organizations to get funds to kind of combat environmental justice within their communities. So I'm not sure if that's totally applicable, but like I said, I don't know exactly right now, but I can do some research and get back to you all and send it to Esmeralda to maybe share with you.
Great, thank you.
And I want to say thank you so much for having me today. I'm so glad that we're having this conversation. Thank you so much to Esmeralda and for Samantha for setting this up, and Leslie. And yeah, I'm just really grateful that we get to have these conversations.
Thank you so much. We will close up the Zoom room in a few minutes. If you want to ask a question, you have 2 minutes to do it.